Hi Jerry, I don't want to do this to you, but like it's been what, 3 years, I believe. Last time we talked, you just left the Warriors. I know there's a lot going on back then, but like uh after that you've been with Sacramento and
Yeah,
I believe you're with hockey right now.
yeah.
So
Vancouver Canucks. Yeah,
yeah, yeah. I'm not really familiar with hockey, but like anyway, can you like introduce yourself a little bit?
sure. Yeah. Gerry Ramogida, like you said, last time we spoke, I was with the Golden State Warriors. I was there from 2018 to 2022. Prior to that, spent 17 years with the Seattle Seahawks. And prior to that, and during many years in international track and field, um, where I had the good fortune of meeting and working with Dan Pfaff, who we'll touch on, and a number of other track coaches that you are aware of from the Altus Speed Summit that you know anyway, Stu McMillan, Kevin Tyler, um, and that kind of area of the performance ecosystem. And yeah, track really was kind of the foundation from where I came and where I learned and where much of what we'll speak about today kind of evolved, and we iterated and have this model, um, and really the understanding of sprinting and other and other power speed events, the jumps, the throws, and the demand for working in that environment to understand the mechanics or the biomechanics of what the athlete was trying to accomplish, being able to having to have that knowledge, observe motion, work with the athlete and coach, and then have precise inputs in an effort to improve movement was really what came about through learning in that environment, and learning with people like Dan. I mean, Dan was the first one who introduced me to that whole idea. I was taking ART. Um, I was an assistant instructor. Dr. Mike Leahy put together a collaboration between himself and Dan Pfaff. There were a number of the early instructors within ART who worked with Dan, Dr. Mark Lindsay, Mark Scapitici. And as a result of that relationship, we had this opportunity to go learn this biomechanics on the track. And so at that time, I had an opportunity or a choice to make. Dan was in Austin, Texas, and our next course that I was going to be an assistant instructor with was in Dallas the following weekend. So I thought, I could go to the biomechanics course, fly home, work in my office for the week, and then come back. And then I was like, or I could just stay in the fleabag motel across from the track and work with Dan for the week and just see how much I can learn. And really, that I people ask me, what shaped your career? That one decision probably had the biggest impact on the trajectory and direction I went. I was already working in track and working with people who were almost of the coaching tree from Dan, Derek Evely, Kevin Tyler. But when I made that decision and I stayed, I took the course and I said to Dan, listen, I'm here. I want to learn. I'm willing to work. You know, can I stick around? He said, absolutely. And for that week, I was on his hip on the track, and he was taking me through, you know, the progression, like watching sprinters and coming out of the blocks. And okay, you want to see a 10 to 12 degree increase in shin and spine angle with each step. And you want to see ground contact times becoming shorter, and you want to see flight time becoming longer, and the crescendo of the sound, dun 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 dun. So he was just taking me through all of it, and then watch this guy's ankle, look at it compared to the other side, what do you see? Okay, go take him. Can you just improve his dorsiflexion and send him back? And so this whole idea of observe, treat, reobserve kind of emerged. And now we have we've taught in the past at Altus the performance therapy program, which was usually four days or so, where we went through this, and Dan was there, and Stu, and COVID kind of stopped that. And now myself and Andy Burke, who works with the Orlando Magic, we ended up taking Guy Voyer's fellowship program, the Soma therapy, and added in much of Guy's influence in terms of the one thing with Guy is his an anatomical understanding and knowledge is precise. You know what structure you want to impact, why, where it is, and what the link is anatomically to how it relates to what you want to accomplish. ART was much like that, but was more around myofascial tissue, not myofascial, more around the musculature in the early phases of ART. And so now Andy and I have come together using the performance therapy methodology as a basis, and then we've developed a hands-on program to teach the most commonly used osteoarticular pumping from Guy's work that we use on a daily basis. So it's evolved over the years and through different sports and different experiences, but the foundation of all of it for me came back to that interaction in that 1 week. And from there, I worked with Dan regularly. I often went down to the University of Texas, worked with, for me as a Canadian at that time was Donovan Bailey, who broke the world record in the 100, and Bruni Surin, who ran the same time in subsequently, and I'm trying to remember what they ran, 989. I think they both ran, or 984, 989, I believe. But I had this opportunity to work with these world-class athletes and put this into practice. And as a young practitioner in the first decade of my career, that was a blast.
Yeah.
And then I got the good fortune to then take that to the Seahawks and moving forward. But with that idea of what can I do with my hands-on skills to help an athlete, quote unquote, move better?
Mm.
Yeah.
How so damn, so working from Dan to like Seahawk to Warriors. So when I was there like a few weeks ago when we were at San Diego,
Mm-hmm.
I kind of noticed that the way you do like joint mob is a little bit different than like how traditionally it is taught with the system. Um and I wonder like is that a thing that you learn from Dan, or is that a thing like you guys kind of like develop that thing
Well,
together?
yeah, what you saw when we were at the Speed Summit, we were doing that work. I was using that was Guy Voyer's. That was an example of Guy Voyer's osteoarticular pumping. When we look at a joint, what we have to remember is that joint is filled with fluid. That fluid moves. The movement of that fluid and the efficiency or the effectiveness of the movement of that fluid is what provides nutrients to the joint cartilage. It removes waste product. If there's inflammation, it's typically within that fluid. And then the joint capsule is also made up of collagen and the collagen matrix. But collagen itself is a tube that is filled with water. And so on every level and every layer is a fluid filled structure or environment. And what osteoarticular pumping looks at is using the hands on work along with the individual's initiation of motion and then your reinforcement of the motion they create to, in essence, pump the joint to move fluid. It's not necessarily designed to be a purely mechanical mobilization, as like you said, it doesn't look like traditional mobilization. It's not designed to be purely a mechanical moving of the joint. And so what you saw was, we were working on the navicular, and I had the person, I said, just pull up and in with their foot, so they're lying supine. Pull up and in. I am restricting movement of the navicular. So when they pull up and in and I restrict them into a pronatory position, the rest of the foot moves around that navicular. So I'm accentuating pronation. And then when they relax, I accentuate the motion. And so I'm getting a pumping of the talonavicular joint. And there is a mechanical influence, because whenever we put our hands on someone, what we have to remember is often we will be searching for a mechanical change. But in addition to that, the mechanical, the joint itself is surrounded by numerous ligaments and then a joint capsule. Those tissues aren't there simply for mechanical support. They're loaded with proprioceptive nerve endings. They're there with mechanoreceptors. There are Golgi tendon-like organs, And so when we impart a manual input, we're also creating this temporary stimulation of those particular receptors of the various receptor types. And from a movement or a motor learning standpoint, you improve the mechanical environment to a degree. You have this big this big input of peripheral sensory information that's going to the somatosensory cortex. So you have this transient window of increased awareness at the brain level, and then you have the athlete go right back into the movement pattern. So they have this opportunity to now incorporate what you've made available into their movement pattern. And so that hands-on work serves on multiple levels. It's not just mechanical, it's also neurologic or neurophysiologic in terms of the receptor types it influences. If we look at the musculature, we got obviously the intrafusal fibers that have attachment into the muscle tissue itself, as well as the fascial layers, the endomysium, epimysium, perimysium. And those, because of the direct fascial continuation that makes up the musculotendinous junction where the Golgi tendon organs live, there's this direct mechanical connection, but also a direct neurologic connection. And it's my contention that the quality of the tissues, the quality of the collagen matrix, if we keep going deeper and go to the kind of terminal end of the extracellular matrix, the information the brain can receive, or the information that the spinal reflex is going to the cord and back, that we're dependent upon for reflexive movement and motor learning, and ultimate, in the skilled situation, power output, our output can only be as good as the quality of the sensory input that makes its way back. And so I've been spending a lot of time in the last little while really diving into the neurophysiology research and seeing if any of these thoughts are validated. And it's encouraging that there are numerous studies that show that the quality of the sensory input does have impact on motor learning, on motor output, on strength expression. So yeah, that's, it's been like I said, the whole process has been an evolution over 30 years. And now we're kind of coming to this, having a better understanding as to potentially what our hands are doing. And, complex systems, Nikolai Bernstein, Stergu, and there's various people with going into that world or that realm. It's like, when sensory input is degraded, the nervous system narrows the available movement solutions, because it can't accurately estimate the consequences of the movement or the options. It can't clearly sense what's happening. And so if you restore the fidelity of that afferent input, it clears that. What am I trying to say? It increases the access to a wider range of solutions in the environment, or that the environment demands. And so, from the almost, if you will, a molecular level down to the extracellular matrix, out to overall expression of movement, there's this nice continuous link, or this chain, that we can. I mean, I'm hypothesizing a lot of it, but there is significant amounts of research from these various disciplines that confirm some of these influences.
Nice. Nice. I love it. I love it. Uh no, I love it because I was actually doing another mentorship that like they teach a lot, like they also teach a lot of different ways to like not necessarily joint mobilization, but a lot of it is based on like uh proprioceptor, like neurology and motor learning. I was like, why didn't the traditional like PT or AT like teach all this? But anyway, um, I was gonna ask you like, so the stuff you do, that's just a small part of stuff you do, but like the stuff you do at Speed Summit is really fascinating. Um, s- I guess my question is, how do you do you feel like uh I mean, it's working with Dan is different than working in team sports. So how do you bring that skill set to team setting?
Right, right. You know, I've worked in numerous teams in different types of environments and different levels of collaboration. And, the pinnacle for me was working with Dr. Rick Celebrini at Golden State. I've worked with him for many years prior, and we both hold that common belief that manual therapy creates that transient window of increased awareness, and you need to load during that transient window to get the most benefit of the hands-on work. And so in that environment, it worked great, because for every athlete, we had an idea of, well, what we would do is every off season, we'd review every athlete and look at their injury history from the season, look at their history going way back, think about and chart out the areas that we know are limitations for them, that are restrictions, or areas of concern dictated by the history. We would develop a plan that went from table to the strength and conditioning to the court, and it was a continuum, and it was designed to happen on a daily basis. We had an athlete that we acquired a free agent when I was at Golden State, and he had the history of a acute compartment syndrome to the shin, to the anterior aspect, tib anterior, and it had to be relieved by surgery. But because of that, he always struggled with foot pain, foot discomfort, foot symptoms, lower leg issues, because when they go in that type of scenario, it's an emergency situation, because you're worried about the health of the neurovascular tissues. So they literally just cut the fascial into that fascial plane to release the pressure. So, for that athlete, we knew, okay, we need to ensure that through the foot, you know, I can't remember the exact numbers. It's 28 bones and
26.
26 bones and 32 joints. Yeah.
Yep.
Well, each one of those joints is there for a reason. You know, biologically and evolutionarily speaking, a joint doesn't just stay there because it was there before. There's some contribution of value for evolution to keep it and for it to be designed that way. And we know that as an athlete goes from heel to toe or from midfoot to heel to toe off, or however, depending on the velocity they travel, each one of those joints sequentially contributes to allow for us to observe active dorsiflexion. We know, though, that the first ray with the cuneiforms with the navicular with the talus, all that has to happen. And actually the summation of the degrees through there is actually more than what we observe at the talocrural joint. But if that navicular doesn't move down and in during pronation, the wider neck of the talus can't fall. That doesn't get out of the way of the tib fib. And so you get reduced dorsiflexion. All this to say, because of the injury history, we had a plan to ensure that we tried to do as much as we could to improve what was available to this guy in terms of range of motion and tissue quality because of the post-surgical scarring. But as soon as he got off the table with me, we would do some loading on a slant board and have him do both A to P loading, angular loading, and then he would go straight to S&C to work on now incorporating that into more directly related sport-related movement. And then his position coach would then work on it further on the court. And so, that taking it to sport in that environment was, I mean, like I said, it was the pinnacle for a reason, because it was completely integrated. Obviously, in a lot of situations, unless that is fostered and the philosophy of working that way is established, it's not easy to do. So there have been situations where that has happened where I've been. And really then what it comes down to for me is knowing the athlete in front of me. Let's take hockey for an example. Like you said, you don't know a lot about it, but if you watch a hockey player accelerate, the acceleration from a stop through the first 3 to 5 steps, it's pretty similar to when an athlete comes out of the blocks. You want to see shin and spine angle kind of increasing congruently. And, you have knee drive on one leg corresponding with push off on the opposite. And so by knowing what the movement demands and knowing where they need appropriate degrees of motion, that guides what I check every day. When they drive their knee up and they want to get the knee up as high as they can and then strike with a nice straight with the skate blade to the ice, they need appropriate dorsiflexion, right? If they want to generate more power coming back down to the ground, they have to be able to develop a nice knee drive to create free stretch on all those posterior chain structures to then explode down to the ground. If they're driving the right knee forward while the left leg is pushing off, you need appropriate counter rotation at the thoracolumbar junction, because it's the way we work. Opposite arm moves with opposite leg. And that creates a nice creation of elastic potential through that cross body relationship through the posterior chain. And so when you know from a biomechanical standpoint what the athlete needs to accomplish on a daily basis, what those repetitive motions stress, it gives you a clue of the tissues that you should check, the areas you should assess and spend time looking at and treating to just allow them to continue to perform the sport. And so even if you become very isolated, your knowledge of the sport, your knowledge of the skill the repetitive patterns that they have to be able to accomplish. You could take it anywhere. We could talk about NFL football and a defensive back. They want to go in a back pedal and then plant, open at the hip, and then cut at a 45. So if you know what they need to accomplish, then that can guide your areas of focus. And yeah, so it's really just knowing the sport you're in, what the athlete's trying to achieve, and then, having a hypothesis in your mind of where I want to look and why, and then do I have the techniques to efficiently change or improve what's there? And that's the nutshell, I guess, in the
Nice.
nutshell.
Yeah, nice, nice, nice. So you kind of you talk about like uh walking ice hockey player sprint. It's kind of like the same with sprinters came out of block. You also talk about proprioceptors, fluid dynamic in the joint. That all that stuff like you don't really hear a therapist talk about all that. So what make you go into like that direction, I guess?
Good question. part of it, part of it has definitely been the influence of the multiple mentors I've had over the years. I mean, Dan, if you hang around Dan enough, you're going to hear him talk about fluid dynamics. That's one of his kind of favorite things. Guy Voyer, fluid dynamics, fluid movement. The fascia is primarily water, hydration, gel sol. Like that idea of fluid dynamics has been pervasive kind of in my education. Again, like you said, I didn't learn a lot of that in school. That was influenced after by people kind of in the field, and Guy, looking at the interrelationship or the connectedness of the structure of the body. Myers introduced it with anatomy trains, but working with Mike Leahy, those were concepts we were talking about years before Myers came out. And so it's kind of just a long history of mentors pointing me in certain directions, and then in having the desire to be able to show people this methodology, it's just forced me down the rabbit hole of all these different things to try to synthesize, bring together the available research, what's backed up, what is maybe still potentially ahead of the research, but there's good, solid foundational evidence to back up the premise. And so, like I was saying, this last few weeks, last month or so, since the hockey season has ended, I've really dove deeply into really trying to give a solid foundational framework that the research backs up. When we started teaching that performance therapy course, like I mentioned at Altus back in 2015, I think, there was very little on the research side. There was very little even on the neurology side that applied directly to performance and motor learning and things like that. But now the research, the volumes of research has really matured, and so there is a lot more available. And then the whole introduction of complex systems. I mean, Bernstein was talking about degrees of freedom and practice without repetition without repetition, like talking about those things I mean, a long ago. But it's really cool and fun to see how all comes together in how um, you know you can see the influence your inputs can have on a complex system.
Nice, nice. Um, I guess the next question would be like, we all work in teams, or we all work in team sport. And obviously, like, I feel like our field, like, more going towards like evidence-based, which means like
Mm-hmm.
research-based. And like somehow I don't feel like that's a good direction. We're losing a lot of art. We're losing a lot of like input from guys like Dan, guys like Bushexnator, or like all those guys you mentioned. But anyway, so how do you like, I mean, when you're able to like showcase your skill set, and like you said that a lot of it is before the research, like how do you communicate with your staff?
Yeah, um, it's a good question. I always had a, even without the backing of the research, I always worked to develop my own conceptual understanding, and to the extent that the research was available, trying to make a common sense. If it was a reach, it was a reach, but at least try to base the reach in what was available. And I'll be honest, like even when I got when we got to the UK and Dan and I started doing our thing, we had senior coaches tell us that athlete is 28 years old. You're not changing their mechanics. Like, and and I would always laugh because I mean, how many times in Tiger Woods' career did he change his swing? How many how frequently does a swimmer work on their technique? And then suddenly, because it's running and we all do it, you can't change it. But I didn't have anything to fall back on other than my observations in working with numerous athletes. And so sometimes it comes down to your conviction, and which can't is sometimes isn't great because you're biased to your own belief system. You still need to be open to the fact that people could poke holes in it. And like I said, when I started, I had very little to back it up other than the fact that I was observing these changes with athletes over time. And it was the benefit of this methodology and being in the environment full time that we could do this, observe, small input back into the activity, reobserve, but we could do it every day. And so on the time scale that is necessary for athlete movement to evolve, we were fortunate. We had the influence on the time scale required. You know, it, it it's it's tough. It's tougher in a clinical environment for sure. You see someone for 20 minutes. You know, if you're a chiropractor, some people are even treating shorter. You do a whole bunch of input and then they leave and go sit in their car for 40 minutes to drive home. Are you going to see change? You know, symptomatically, they're going to have some relief. You give them some exercises. And, you know, if someone that you're working on has some inherent underlying weakness because of postural strain and postural stress and the things they're exposed to every day, and you give them the right combination of exercises combined with freeing up movement, can it help? Absolutely. Can that approach work in a world-class athlete that's searching for the thousandth of a second, that cumulatively they gain a thousandth, a thousandth, a thousandth, a thousandth over time, that changes a 9.9 to a 9.7. I mean, and that's being dramatic, but the environment of a training athlete, if you have the capacity to be involved in it, is unique. And the goal to optimize, or the goal to for the athlete to want to get better, you can have an impact. And I'll also preface that with the idea that the athlete obviously has to be involved in the process, and they want the same outcome. The coach has to be involved because they need to support what's happening. And when you have that integration of athlete, coach, therapist, everyone's speaking the same language with the same goal and the same understanding of how you're going to get there. You need that for sure. Um, and so yeah, the high performance environment is unique, and that's also why I think this has the influence it has. Can it work in lower levels? For sure. Can it work at the collegiate level? For sure. Can it? I think it can work with developmental athletes. But again, all things, like I said, the athlete, the coach, the therapist, everyone needs to be on the same page and has an understanding of where we're going.
Nice. I love this. Um, you probably already know like NBA, even hockey are moving towards this biomechanics direction, right? Like everybody's like doing this biomechanics lab, and like you work with dance, so you know like the whole concept of like if you want to make it work, there's a certain way to do it. And I mean, you don't have to do exact the same way like you guys do it. You don't have to be the same way like, oh, do the manual and do what? But like there's a way to work. And I feel like basketball world are trying to figure out like how to work. I'm like almost doing education right now. But like talk to me about like thoughts on the whole biomechanics initiative in team sport and how you feel like like how can we like make the most of it?
Right. Well, I think the movement towards biomechanical evaluation is great. I think a big part of it, however, has to do with the context in which the biomechanics are captured. For one, is it captured in a like I've seen it, well, you've seen it, where they set up a square with cameras everywhere, and then they're having them do movements in a confined space. Is that informative? Sure, it can be informative in terms of how they might be doing some of their fundamental movements, but can you do capture of how they're expressing patterns under the stress of a game, under the stress of a defender, um, because that changes what you're going to see. And so I think the idea of capturing biomechanical information is valuable because you can see where there are potential areas of repetitive stress or strain on specific tissues because of a pattern they've fallen into, or that's their preferred way of moving given the restraints they have. And if you can identify that, then once identified, you can develop a strategy to improve it. I guess the next question is, yeah, it's great to get the biomechanical evaluation. And then, like you said, now what do you do with that data? And it's the argument we make with all data. Just because you can record it is great. But what do you do with it? And so I think the biomechanics is informative. The next step is when you see the aberration, what's your plan? What's your plan to attempt to make change? And then are you going to be able to reevaluate it within a time frame that you agree is appropriate to see if you're making change? And if not, like how do you know? And so I think it's great. I think to be successful, like I said, you need to be able to identify what you as a staff agree is acceptable or falls outside the bandwidth of acceptable. Two, now you see it. What are you going to do? And then third, when and how long do you wait to reevaluate it to see if you're going the right direction? And on the court, is it actually helping them? I understand. Sometimes with an athlete, you might have to take a step back to take two steps forward, for sure. At the NBA level, at the NFL level, at the highest levels, the other question is, does the organization have the patience or the desire for that potential outcome? And so, yeah, just because if you can measure it, it's great. What are you going to do about it? How are you going to reassess it? And is it what you want to do? you know,
Nice, nice, nice. So, um, putting this all together, what like would you feel like because obviously they try and do this to trying to like decrease injury, which I don't know it's possible right now with like the rule change so much, the speed of the game becoming faster. Um, do you think that I don't know, like uh purely getting athletes stronger in basketball, just basketball. We're not talking about
okay.
track. We know that doesn't work for track. We know that doesn't work for football. In basketball, do you think that's gonna work? I mean, the speed's not gonna be like track crazy, right? Thoughts on that?
Do I think that getting an athlete stronger in basketball
No,
will,
like just forget about the whole forget about all those small details in joint movement. Forget about SI
right?
joint. Forget about scoliosis. Forget about like is this talus stuck or not? Do you think like purely getting athletes strong enough is enough right now?
Do I think getting the athlete strong enough?
And ignore all of that is good enough.
No, no, you can't. You can't. It's a complex system. We can't pick one variable, say we're going to make this better, and then expect it not to impact any of the other variables. I think Gray Cook, when he developed, oh,
FMS, SFMA.
FMS, and his whole thing was you can't build strength on a, you, you can't build strength on a, he has very distinct wording for it, but it's basically you can't build strength on a compromised joint. Building strength as an isolated variable, as your go-to, I think will lead. It's like an onion. You have the first layer, strength. You pull that layer off, and now you got layer after layer after layer. I think it's just the body is too complex to isolate one thing and think that by improving one aspect, you're going to have positive return necessarily. Could it? In specific cases, absolutely. Can we make that generalization? I think it's dangerous.
Hmm. Maybe so.
Well, let me take you back to that, what we were talking about before. An athlete has history of an Achilles rupture. They do surgery. The musculotendinous junction is crusty and fibrotically changed because of the whole return, and they get back. But those Golgi tendon organs are landlocked in there, so the brain's not getting that information. It's not getting all the information from the muscle spindles in that area of the involved musculature. You build a bunch of strength in the gastroc or the complex, the lower leg complex. And can we say that then when you put them on the court, the coordination, the rate of force contraction, force production, just because there's increased strength, does it mean those other required capacities of the rate of force contraction, change of direction, putting the body in an advantage position, are all those things going to occur in a better manner because there's now more strength, given that there's a lack of sensory input? I don't know.
Mm. All right. Following question. Like I said, like I feel I'm moving towards research based, not even evidence based, research based. Um, and we're losing guys like we're not getting input from guys like Dan, guys like Boo, guys like I don't know, Gary Gray, all those big names. Somehow, and all right, so this is what I'm gonna ask. In the past few years, like NBA did a research on I believe it's a J League basketball player. Like their mid-tarsal joint is stuck at age 21, right? Do you think that's like part of the reason we're getting so much soft tissue injury right now?
Didn't see that study. I'd love to read it because that sounds really interesting. Um, I think, generally speaking, if let's talk about the foot, and we kind of touched on it earlier, that mid tarsal joint serves a purpose. It contributes movement, obviously, to the collective required for the foot to go from heel strike in a slightly supinated position, going towards pronation, to then turn to then be able to push off at the second ray. If that mid tarsal joint is rigid and can't contribute, so they can't effectively absorb the force as they come over. And these guys, some NBA guys are pushing 220 to even heavier, some of the big guys. There's a lot of force, and then that force is ultimately contributes elastically to push off. If the foot itself becomes an ineffective, for lack of a better word, it becomes an ineffective lever for push off because you're leaking energy because of joint restriction, alteration of tissue loading. The brain or the athlete still knows I have to get to that ball as fast as I can, and I'm going to find a way to get there. And so they may not be able to produce as much force through the foot or through what we would deem to be an efficient pattern. They'll choose the one that's most available to them in that moment. But over time, does that joint restriction lead to tissue overload? It diminishes the variability of motor expression or movement expression to that athlete, and the same tissues become stressed repeatedly, and ultimately we see that as a catastrophic failure. I think the research is clear that as movement variability decreases in an athlete, we see the increased likelihood of a repetitive strain type injury in runners. So, are these things can joint restriction over the long term or medium term contribute to increased soft tissue injury? It makes sense that it can. And so I think it speaks kind of to what we touched on when I was telling you about the athlete, what they normally do, what their what their skill expression is in their sport, and then trying to find the key areas that have to move well to let them do that. I think it speaks to the importance of maintaining that checklist in your mind relative to the athlete you're working with and what they need to accomplish.
Mm, Um, Following question, and shout out to Adam Petway, my mentor. He also asked the same question at Altus Speed Summit. So I'm gonna ask it anyway. Although you guys already answered it, but I'm gonna ask it anyway. Um, so obviously in the past few years there's a lot of Achilles tendon, especially last year. And Dan speaks on the speed of uh the ho- the speed of the dorsiflexion, right? Is is it able to like decelerate the dorsiflexion? Um, I guess I want to ask is I think what he asks is a lot of them or a lot of basketball players had the big toe bunion. So when they push off, they actually have they actually are externally rotated and
Mm-hmm.
excessive pronation.
Mm-hmm.
Maybe that's a way for them to find internal rotation to push off. Do you think that's one of the contribution to like I'm putting you in a hot spot here, but like, do you think that's one of like the reason we have Achilles
We have
tendon?
more.
Yeah.
It's a good question. I think, can that does that mechanism of of increased external rotation, the bunion to altering the capacity to push off from the big toe. More interestingly, I think, does that obviously creates more torsional stress about the lower extremity axis. Does that torsion through the Achilles, in addition to the force production, introduce another variable? Um, I would I would trying to think what I would safely say in relation to that. Is it the reason? Is that a new strategy relative to players over the last 20 years? I don't know. I would almost hazard to guess that you might have seen that because shoes are getting better, they're more supportive. Um, I don't know. I don't know. I think there definitely is a trend towards athletes displaying more power output. They are bigger, stronger, faster in the same confined space. And so I think more than likely it's the fact that they can express more, they can express force and dynamic movement. They're doing it at higher and higher levels, and we're pushing the performance envelope, and which, just by nature of that, are we getting beyond the capacity of the tissues at times when we layer in potentially compensatory aberrant strategies because they have the bunion and the locked mid tarsals, and they're externally rotating. And I think there might be something in that regard. I mean, look at the NFL Combine. You're seeing linemen run, running, almost running in the fours.
Yeah.
Like it's insane. These guys, I mean, they're 300 pounds and they're moving that mass with that kind of power. In times that are, you just shake your head and got. And so I think there's a degree of every year we're trying to make athletes better, more powerful, more explosive, more and
We swing too
you
far
know,
on that side.
well, is it? I don't know. Are there things that we're not doing in concert to optimize every aspect? Is the nutrition optimized? Is sleep and recovery optimized? If we're going to push to get every ounce of performance, are we then doing the same with all those other aspects that we know are important? Are we, like we know when we load collagen tissue or within tendon tissue, it when we if we really load it, we know we need 72 hours in the repair curve. If you don't respect the repair curve and you're always ahead of the curve, should we be surprised when the tissue starts to fail? Like, are we being respectful of the necessary recovery times based on how much load we're putting through a system? And so I think it's all things to consider.
Nice, nice, nice. Um, I want to go back to like your skill set we talk about, like the way you do stuff is a little bit, not a little bit, but different than other therapists. Um, I remember like uh talking to Dan and Dan was saying you guys would try long axial joint mob with like try internal rotation, try external rotation, try um net neutral position. Uh talk to me about like where did this come from?
Just the mobilization. So Guy Voyer has a saying, and it goes back to what I've said a few times now about the foot and every joint having a degree of contribution. And what he says is micro movement dictates macro movement. Okay. So the micro movements of all those small joints of the foot combine to contribute to what we see as the overall expression as dorsiflexion. Again, navicular has to go into pronation to drop out of the way. The If the navicular doesn't drop, um, the calcaneus can't go into eversion. Like, so all those micro movements contribute to the macro movement that we see as dorsiflexion. At the knee, flexion extension. We see the knee and we think hinge, but we know there's as we go into extension, there's a degree of external rotation. As we go into flexion, there's a degree of internal rotation. We know that the menisci are mobile. So we know that we need a degree of internal and external rotation about the long axis of the tibia in open chain flexion extension. And so if we don't have the internal and external rotation, we don't have full flexion extension. And so micromovement dictating macro movement, that's why we would do long axis distraction and then do long axis distraction with internal rotation, long axis, for example, at the hip, long axis distraction with external rotation, osteoarticular pumping toward the end range of external rotation, osteoarticular pumping towards the end range of internal, osteoarticular pumping toward if you're prone and you have the athlete and you bring them into hip extension, and then doing joint pumping of the femoral head from posterior to anterior, then flipping over, and when they're in flexion, doing hip pumping from A to P and superior to inferior. Like, you're working to try to always give the joint a nicely to create a what's the word I'm looking for, to create not freedom in the sense, but to create movement within that joint that it can move appropriately within acceptable range. And
Mm,
so in essence, you're just reinforcing that idea. We need the micro movements. We need to reinforce the small movements that are necessary. as the foot's on the ground and we go from heel strike and go over the pelvis, can we get appropriate, you said it before, can we get appropriate internal rotation at the hip? So with our hands-on work, we're just trying to reinforce or use our input to ensure that those movements are available.
Nice. Damn. You're probably one of the smartest therapists I've ever taught. That's what man, that's why Dan always say like you're the best. Dan said that multiple times.
Oh yeah. Oh, now I'm honored if Dan said that.
Yeah, Dan said like I think I forgot the athlete's name, but like Dan said when he I forgot the name, but like when he worked with an athlete, like you're the guy that they go to, and then the second guy is I think the second guy is Andy Berg, the third guy is Dan. Like he always go back to you.
That's nice to know.
Yeah. So last question before I let go. I guess like I mean so many years in working with elite athlete, learning from Dan, learning from Guy Voyer. Damn, those are some legends. I guess what are like the next thing you're like what are some topics right now like you're interested, you're trying to learn?
Great question. And then going back to, you know, getting to work with legends, like I said before, like I've been really fortunate. Like you said, Dan, Guy Voyer, Mike Leahy. I know you may not know him, but Mark Lindsay, Mark Scappaticci, uh, uh, Dr. Eloriega, who's a is a contemporary medical acupuncture instructor at McMaster University, and teaches um, acupuncture, incredible technique for working with anyone, but especially in sports. Like I've been really fortunate, no question, and all those people have shaped how I look at things. What am I interested in right now, and what am I looking to learn? I mean, there's so much. And it's like the deeper I get, the more I feel like I don't know about anything. you
Yeah.
know,
Yeah.
it's like the more questions you answer, the more questions you have, and it's like, oh man, it gets tiring. Um, I just I right now I'm really focused on really trying to dial in and see if I can't come to some more definitive, better understanding of what it is we're doing. You know, like I said, I think our hands, we used to think we solely made a mechanical change. That's, I mean, at best, if we don't load an athlete or we don't load a patient after doing our work, the those gains of just hands-on work alone are transient at best. And so obviously there is more happening with our hands-on work than mechanical. And we talked about a lot of the neurophysiology and the impact on various sensory receptors, afferent input, and so that's kind of where I'm at, and trying to marry the neurology, neurophysiology, the change at the tissue level, and just trying to put it all together and have an explanation when you ask me what are we doing, because right now I mean I have a lot of thoughts and a lot of hypotheses, and some have more evidence behind them than others, but am I certain of any of them? No. No.
Nice.
So
Nice. Nice. All right. Last last thing before I let you go. You said you mentioned that you and Andy Burke are developing this performance therapist kind of course. So when is
Yeah.
it coming out?
So there is, so we have the course already. It's just, we go through the history of performance therapy. We go through some applied biomechanics, and then we go through the hands-on techniques that we use a lot over the last 20 years, um, primarily based around Dr. Voyer's osteoarticular joint pumping. And we are very close. I think it's safe to say that we are looking at doing that the second weekend in September at Altus in Phoenix. Looks like that's going to happen. So that's exciting for us. We've delivered the course once in Vancouver, and it's we because it's a hands-on course, we have to limit the number because Andy and I need to make our way around the room and help people with hand placement, etc. Dan is going to be at that, and because I want him to his legacy of teaching movement and the movement progressions through which you can watch movement and use those progressions as your observation, treat, reobserve framework. Um, I think Dan is the one who made that a reality in my day-to-day practice. So as a legacy to him, I want as many people to learn from him as possible. So that's exciting. Um, so yeah, that second week in September. If anyone's interested and you want to give them my email address to reach out, by all means, please reach out so I know if there's interest.
Yeah, yeah.
If it's just me, Andy, and Dan sitting there staring at each other, that wouldn't be fun. But
No, no. All right.